Good morning. I am Dr. Arvind Palawat, working as a senior physician in SMS Hospital. And I would like to tell you a few things about blood pressure. Every time heart beats and pushes blood into vessels, it works against the vessel wall, which creates a pressure which is known as blood pressure. Blood pressure, normally in a healthy person, the blood pressure is 120 by 80. And it usually rises and falls during the whole day and night. But when it becomes fixed, it is known as, when the range is around 140 by 90, it is known as blood pressure hypertension. Why it is important? Because it can cause a lot of problems. Blood pressure, the reasons are many. There are primary reasons, there are secondary reasons, but there are modifiable and non-modifiable, which are important from a layman point of view. Modifiables, blood pressures, modifiable reasons are when we have a sedentary lifestyle, when we consume a lot of alcohol, when there is a obesity, there is a smoking, when you consume a lot of fast food, and constantly under stress. So these are modifiable. If we can control all these factors, these are the factors which can cause blood pressure. If we can control them, we can control blood pressure to a large extent. We will not need medications. Blood pressure is usually a very silent disease. It does not cause much symptoms, except it can cause a little morning headache, and it can cause nausea, it can cause a buzz in ears, and it can cause a little bit of sleeplessness in some patients. And otherwise, it is really a silent. So it is more important that it is detected at times and we start treatment at time, at early as possible. It is important that we go to a doctor and get our BP checked regularly. All the more, if we can control these factors, these sedentary lifestyle, we can control our alcohol and tobacco habits. We move out a little bit. We go for a physical activity of 45 minutes or more every day, brisk walking, yoga, all these things, they do have a very beneficial effect on blood pressure. And every effort should be made so that we do not need medication and we can control BP by normal mechanisms. If healthy lifestyle can successfully control, that's well and good. Otherwise, medication is a must, because long-term morbidity and mortality of a patient depends upon blood pressure control, because it can have effect on eyes, it can have bad effects on brain, it can cause CVA, it can cause blindness, it can cause renal damage, it can cause damage in legs also, and more or less, it can cause cardiac damage also. So it is very important that we control blood pressure and we take care of our heart and blood pressure as early as possible. Thank you.